Hi guys, how are you? How are we? How are we doing? How's everything going, guys? Welcome back to my YouTube channel. Makadini, Sanibonani, how are you, Muisei? I hope everyone is doing well and amazing this end of month. I hope July was just amazing to you, and yeah, this is supposed to be a bedtime story, guys, but yeah, I had to try and look nice. And I think I did a good job. Yeah, can you see how my skin is glowing? Let's just appreciate the skin. Huh? Hey, ganda rinona mvura. So from June 2024 up until June 2025, I was doing my internship at Sujo Medical University. So whilst I was doing my internship, we were rotating different departments. Yeah. So maybe 2 weeks you would go and do pediatrics, 2 weeks you go and do gynecology, 2 weeks you go and do a lot. So this at the time I was in surgery. Yeah. So I really like doing surgeries and all that. I really like that. So the teacher that I was given had difficulties when it comes to language. So most of the times I would go there and try to communicate with him. You'd show that discover that I'm not understanding what you're saying, and I don't think you are going to produce anything productive between me and you, because you know English, but me I don't, and me I know Chinese, but you don't. Please excuse me if you hear like sounds. It's really hot and my AC is on. Okay, let me turn it off. So obviously I wanted to do more. I wanted to do more because when it comes to internship, it really depends with the teacher that you have. If you have a good teacher, then it means your experience is going to be, it's going to be good. But if you don't have a good teacher, or your teacher is too reluctant even to, assign you someone who's better than them, your internship is not going to be that good, you understand? So I went to my friends and I told them that, guys, are you doing anything in surgery? I can't afford to leave surgery department without doing anything. I really want to do something. If your teacher is doing something productive, can you actually help me to join so that I can actually do something with you guys? Then one of my friends was like, okay, you can come and I'll help you. I'll talk to the teacher so that you actually join us, because we're doing quite a lot that we haven't done before. So it will be a good thing for you to actually, do hands-on and then get some experiences. I was like, "Bo, guys, I'm coming and I will join you." So when I joined them, they had done, they now had done a lot of things. Most of the times they would go for rounds, and after going for rounds, they would check the patient, check, because surgery, you have to monitor your patient. After the surgery, you have to monitor your patient if they're healing well, anything, the dressing and all of that. So they had already done that. So I had to join and, try to catch up on what they had been taught already. So I was late, and I was just feeling so nervous, that will I be able to catch up with these guys, and also, try and know what they're already knowing. And I don't want to drag them, it wouldn't be good for you to drag others who have already, gone far. You would like to try and, work very hard and just, try and fit in, you get it. So for like 2 days, I was just seeing how they were dressing the patients and all that, dressing the patients, interacting with the patient. How are you, Morisei? How are you feeling? How's the wound? Anything we can help you, you just let us know and all that. So this is the day. So this day now, the teacher in charge called me, and he was like, Alma, get a piece of paper and a pen. Then I said, okay. Then I took my piece of paper and pen. Then he was like, okay, I have your pen and paper. I said, yes, sir, I now have my pen and paper. Then he said, write this down. Then he started calling out bed number 32, bed number 64, bed number 30, bed number 28. Doctor, you now have to go and visit these patients. I said, me, are you being serious? Then he said, yeah, I'm being serious. Those are your patients for today. You know, I'm telling you this and my heart is racing right now because I can really feel the, you know, the feeling that I had on that day. And I said, say, I think you are mistaking me for someone. They said, no, you're Oma. You joined your mates recently and you have been seeing how they are doing. So I think now you are able to to do what they were doing. Ndikati yo, muri serious kuti muri kundisira inini munhu kuti ndinoona munhu and you won't be there. And he said, yeah, I won't be there. I also have my patients. Look, yeah, these are your 4 patients, these are my 6 patients, and you know, so everyone has their patients. We should now go and do what we're supposed to do, guys. Muso ndakati nei Mwari ndio medicine yacho here, like are they being for real? But then jarangoti ndingoona vamwe vachiita. Then he said, yeah, you should now go and check your patients. Guys, the worst part of vavati izvonizvo, you have to dress your patients. Pane varikufanira kuchinjwa dressing, pane vachinjwa dressing, pane varikufanira kubviswa tubing. Then I just had to go and clean them kungoti vange vari right so that their healing is okay. Guys, musiwoka hana yangu yakarova. And he was like, I know you can do this, you know, you're a good student, you can do this, you have been attentive listening to what I was teaching your other mates, so I think you are fit for this. Go and, you know, what I've taught you, just do that. And if the patient complains about anything or they want something else, you just have to call me. But I'm not expecting any call from you because I was already checking up on these patients and I know them, so they shouldn't give you any difficulties. Bye. You don't have an option. My patients are going to mirira. Hapana zvekunobiridzira. Guys. Thank you for watching. I'll be coming back with the part 2. Have a blessed night. Bye.